Mary has been a nurse in the surgical ICU for 45 years. She's known for her excellent clinical skills, especially when it comes to the sickest of the sick. If a patient becomes critical on the unit, you want Mary there. However, Mary is also known for her sharp tongue, abrasive tone, and drill sergeant style approach towards anyone whom she believes isn't equally excellent, which nobody is. Many nurses, physicians, and support staff have been in tears after an encounter with Mary. Some say that Mary just has high standards. Others say she's a bully. How do you know? On this episode of Coffee and Conversations about Nurse Bullying, we're going to talk about how can you tell the difference between a nurse with high standards and an arrogant bully. I'm Dr. Renee Thompson, the CEO of the Healthy Workforce Institute. Welcome to Coffee and Conversations about Nurse Bullying. You know, some nurses are extremely competent and they possess excellent clinical skills. They're the ones you want present in a crisis situation, but maybe not the ones you want consoling a new nurse after his or her first patient death. Suck it up, buttercup. These nurses treat others like they are beneath them. And I've heard numerous stories about so-called brilliant nurses who won't help others. They act like they're the only competent humans in the organization, and they really treat others with arrogance and contempt. How many times have you heard someone justify rude and condescending behavior just because of their great clinical skills, or no, they just have high standards? Are these folks high standards, or are they just a bunch of bullies? How can you tell? Having high standards is a good thing, especially in healthcare when the stakes are high. However, there is a difference between someone who has high standards and someone who is an arrogant bully. And if you're not sure, consider how you would answer these 5 questions about this person. Number 1, what do they talk about? Nurses with high standards talk about evidence and best practice. They typically cite studies, recent research, and attend in-services, conferences, sometimes without even being prompted or paid. They're always trying to improve the care that they and everybody else are providing. Nurses who bully talk about the way it's always been done here. And when, let's say, a new nurse mentions best practice or an article that they recently read, they're immediately attacked. They are the ones who typically don't join committees or councils or attend continuing education opportunities. And if they do, they complain about them. Number 2, do they share their knowledge with others? Nurses with high standards share everything. When asked questions, they stop and answer, oftentimes going out of their way to help someone learn because they understand that by helping their colleagues, they're raising the standard of their entire team and improving the quality of care for decades to come. Arrogant bullies hoard their knowledge and are frequently heard saying, well, that's not my job to teach you, look it up yourself. They refuse to help others even though they could. Number 3, do they teach others? Nurses with high standards coach and teach others. They take others under their wing and help others develop better skills. In a coach situation, these are the nurses who pull the new nurses into the room and say, now stand back, watch this, and we'll talk about it later. Arrogant bullies humiliate and criticize. They make others feel incompetent and are frequently overheard complaining about how stupid some people are. Even though they could, they choose not to help others improve their skills. Number 4, what communication style do they use at work? Nurses with high standards incorporate the assertive communication style. They provide honest and respectful feedback to their peers. If someone makes a mistake or forgets to do something, they don't talk about them behind their backs. They let them know in a respectful manner. Bullies tend to use the passive-aggressive or just plain old aggressive communication style. They may be nice to your face, but then they stab you in the back as soon as you turn around, or they will berate you in front of other people. And number 5, Do they compete or do they collaborate? Nurses with high standards are collaborative. They compliment others for their knowledge and skills and are frequently the ones who nominate others for awards, will ask to partner with them on projects or look for other opportunities to help other people on the team advance. Bullies are very competitive and love to squash their competition. They see the workplace as a battlefield and are always prepared for a fight. If they believe someone is potentially more skilled or knowledgeable, they will spend time and energy trying to slay them. So this is the advice that I gave a manager who actually reached out to me to ask me that question about, his employee. I said, first of all, engage in an honest conversation with this person. Chances are nobody has ever said to this nurse, you may be clinically competent, but the way you treat your colleagues is not okay. You cannot assume someone knows how they come across, and you can't expect someone just to change their behavior because you think they should. Have the courage to tell them the truth. Number 2, set behavioral expectations with this nurse. When you finally engage in an honest conversation about their behavior, the next step is to tell them exactly how you want them to behave. For example, say this: as a competent, experienced nurse, I expect you to become the role model for collaborative practice. This means attending in services, helping anyone who needs help, teaching others skills that you have that they may be lacking. Number 3, have the legacy talk with this nurse. Say this: when you leave here, retire, what legacy do you want to leave? What do you want people to say about you? That you were so clinically excellent, but you were mean and nasty and didn't help others? That you hoarded your knowledge and you tried to squash anyone with potential? Or do you want people to say that you were brilliant and help them to become a better nurse? As professional nurses, it is our responsibility to cultivate a culture where all employees strive for high standards, which can only be achieved when nurses talk about best practice, share their knowledge, teach each other, and are honest and respectful of each other, and collaborate with all members of the healthcare team. There's a fine line between competence and arrogance. Bullies cross the line. Don't let them. Okay, I'd love to read your comments about this topic. And if there's a situation that you actually want me to talk about in this video series, just post it in the comment section below. And if you like this video, make sure you subscribe to my channel and share it with others. And if you really want to learn more about how you can eradicate bullying and incivility in your organization, go to my website, www.healthyworkforceinstitute.com, for more resources. So until our next conversation, be kind, take care, and stay connected.